As many of you have probably heard or read in the press and other outlets, the number of COVID-19 positive test rates and hospitalizations are unfortunately exceeding those levels we experienced earlier this year. While treatments have improved dramatically and the hope for a vaccine is becoming a reality, we still have a challenging journey until things are back to normal. As we face this new spike in COVID-19 cases, it is imperative that we still maintain and follow established protocols to help curtail the impact of this virus on ourselves, our fellow employees, and our families. We want to take this opportunity to again review the expectations for all Ion Apex employees at all facilities where we are working. This includes job sites, the training center, warehouse, and the home office. OSHA has clearly identified that some areas are more prone to exposure and risk than others. According to the OSHA guidelines, Guidance on Preparing Workplace for COVID-19, work areas have been classified into 4 categories based on the level of risk. They are as follows. Lower risk exposure risk jobs are those that do not require contact with people known to be or suspected of being infected with COVID-19, nor frequent close contact within 6 feet of the general public. Workers in this category have minimal occupational contact with the public or even other coworkers. Medium exposure risk jobs include those that require frequent or close contact, again within 6 feet of people who may be infected with COVID-19 but who are not known or suspected of COVID-19. In areas where there is ongoing community transmission, workers in this category may have contact with the general public, such as schools, high population density work environments, or a high volume retail setting. Now, the high exposure risk jobs are those with high potential for exposure to known or suspected sources of COVID-19, such as a hospital or a care facility. And very high risk exposure risk jobs are those with high potential for exposure to known or suspected sources of COVID-19 during specific medical, post-mortem, or even laboratory procedures. While precautions must be taken no matter where you're working, be aware of your surroundings and when and where your risk for exposure may be elevated. First of all, if you have any symptoms at all of COVID-19, and these include but aren't limited to persistent fever, cough, shortness of breath, loss of taste or smell, then stay home. Let me repeat, do not come to the job site, the school, or the office with a fever or any of these symptoms. Also, we must remain diligent about taking temperatures accurately twice a day on job sites and keeping those records logged. Do not shortcut this process. Our safety director, Mike Dudley, will continue to collect and monitor these logs. Your work site supervisors and coordinators will make sure that each site has an adequate supply of masks and approved cleaning and sanitation supplies. If you have a concern on your site about COVID mitigation, reach out to Mike directly and he will work with you. Remember, the mask, cleaning, and sanitation supplies need to be used to be effective. Anyone who comes onto a job site and has a fever will be asked to leave and will not be rescheduled for work for at least 72 hours. If that person has accumulated personal days they want to use, they just need to contact HR. If for any reason you feel a need to be tested for COVID-19, make sure you schedule your test through a medical professional, such as your physician or recognized testing agencies such as ArcPoint. The test kit and the testing methods must meet given standards and be reviewed by a medical professional to meet the requirements of the Families First Corona Relief Act. Contact Tom Cox, your HR manager, for more details. We remain available to answer any questions you may have. Do not hesitate to reach out to your HR department if there are any concerns or if you're unclear on any procedures, benefits, or resources available to you. If after testing your test results are negative, ask your medical professional if additional testing is required and request a return to work release. If your test results are positive, follow your doctor's advice, contact HR, and return to work only when your doctor allows or after receiving 2 negative tests within 24 hours between each test. If there is a COVID positive test result on any job site or facility, not limited to just Ion Apex employees, follow the established, previously issued guidelines when COVID-19 shows up on a job site. All Ion Apex personnel will vacate the site for 82 hours from when the infected person was last present on the job site. Remember, wearing a mask that covers your nose and mouth, Frequent hand washing and cleaning of shared tools are essential protocols to help reduce the risk of contracting or spreading the virus. If you're uncomfortable with people around you not wearing a mask in any work setting, you have the right to request people who are working in your immediate work group to wear a mask. This request will be honored by your teammates. If that request is not honored, please notify your supervisor, the safety director, or HR. Do not feel pressured to compromise or work in a work group where your request is not honored. Remember, stay home if you're sick, take job site temperatures twice a day. If you feel a COVID-19 test is required, go through a medical professional. Contact HR if COVID-19 is involved, and follow the medical professional's advice. Also, remember to contact HR to return to work when permitted by a medical professional. As we continue to deal with COVID-19, there will be an increased awareness of possible exposure to the virus. At any point you should feel a test is required, then by all means, get tested. Just follow the procedures we've explained in this video. Again, as always, thank you for all your do. Stay safe.